Namaskar. Welcome to the panel discussion on blockchain for healthcare. Today we have an eminent panel of discussants and they would be touching upon different aspects of blockchain. We'll start straight away and our first speaker is Venugopal. So first introduce yourself a bit and then you can just give your opening remarks. Over to you, Venu.
Thank you, Dr. Sukten, and thank you for having me as a panelist here. My name is Venu. I've been in the IT field for a few long years. I am a founder and the managing director of an Indian IT startup called APRI's IT Solutions. Right now, we are bringing up an healthcare app called Ashwinav Health, which works well with the NDHM framework. We'll hear more about what NDHM is, and it does a little bit more on top of what NDHM has to offer. That's a brief about it.
Thank you, Venu. So the next speaker, Vikas Singh. Over to you, Vikas, your intro and opening remarks.
Thank you. Good afternoon, everyone. And it's my privilege to be here. And so I'm Vikas Singh, and I'm the co-founder and CEO of Blocklabs.com. We are an emerging tech product company in the space of primarily blockchain, machine learning, artificial intelligence, and IoT. And we have built now sort of tools and SDKs for future of work. We have done substantial amount of work in securing documents on using blockchain, and we have some good products around these especially areas where you need more remote collaboration. We have an alternative of something like this, something of this sort product. So we have those products, and I have dipped some of my fingers in the past as an employee in a healthcare startup as well. So maybe I'll be able to sprinkle some ideas and learnings of these of the two sectors in front of everyone. Thank you.
Thank you, Vikas. Dr. Arna, your turn.
Hi, I'm Dr. Arna. I'm really honored to be here. I'm a digital health expert roster member at WHO and also serve as a president of Government Blockchain Association India Kolkata chapter. Also part of blockchain task force at HIMSS USA. And a strategic advisor of Pharma Trust UK. It's a pharma blockchain supply chain solution provider. First of all, I want to extend a warm welcome to all who are listening. And many of us know a famous proverb, like if you want to go fast, go alone. If you want to go far, go together. And I believe there's no better tech than blockchain that that epitomizes this proverb. Thanks.
Great. So I think we'll come back to Venu. So you can start in a layman's term, describing what is blockchain, and then of course we come into the healthcare aspect, what is FHIR, and how is blockchain, which can be linked to the National Digital Health Mission. So over to you, Venu.
Sure, sir. So blockchain is a network, in a simple word, where we have various participants joining over the network and transact in a manner where the trust can be delegated to the network. And once a transaction is done, it is immutable. Meaning you can leave the trust part to the network and do your business. So what that means is it can help for businesses to expedite their business processes or even automate some of the steps where they will need manual intervention and therefore deliver faster turnaround cycles. For example, in the financial world, so blockchain has been very active on the financial side. If we take a use case of remittance or the over-the-wire transfers between different countries, even with all the technology solutions we have, we may still be transferring the money across the wire probably in a half day or maybe 3 hours or at max a 1 day's time period. If we implemented blockchain right, then it is possible to make the transfers happen in less than 10 seconds. And then there is no way that a fraud can happen in such kind of transfer mechanism. So blockchain brings that trust between the participants and the network. Now coming to the healthcare aspect, Dr. Sukten, before even I come to healthcare. So the way blockchain achieves is it provides a digital identity for each and every participant in the network, and it also enables a mechanism of giving a key where they could sign their transactions, and only they can view the transactions that they have sent. So if I look at healthcare aspect, that's my passion currently. Um, and we have a national digital health mission that's happening up for us. And this is a wonderful step for us. All of you great people have brought us the national health policy in 2017, and that went towards the national digital health blueprint. And now blueprint is now extending to the national digital health mission. So we're seeing all the fruition of your efforts that you're putting, right? So NDHM, what it does is it gives health ID to each and every citizen of India. So what that means is that if I go to any healthcare provider, I can be identified by my health ID, and there can be no disambiguation at that. So I am what I am. And at the same time, if I want to preserve my health ID, there are mechanisms that are put in. There are also plans for NDHM. So NDHM kickstarted very fast. We are also living at a challenging time in our existence, where the pandemic is also upon us, and we're waiting for the vaccines to be delivered. At the same time, it takes a lot of courage to bring something of a digital health platform that has been thought of for a very long time, but has not come to the existence for various reasons, right? So we're having that, and at the same time, we are doing all other things as well, right? So NDHM has taken this approach that start small and grow big, right? So if we have the understanding right of NDHM, it might go live, or if it is not already live in some of the, it has started as pilot phase in some of the places. I may not be the right person to talk about all of that, but there is an indication that the health ID would be made as an open ID, meaning I can use my health ID across any applications or any mobile apps or any clinics that have or that offer services using the health ID service. There is no need of signing in or logging in with multiple IDs. There is no need to remember multiple IDs. So NDHM also goes a step forward, and we want to issue the DigiDoc ID, which is called the Digital Doctor ID, and doctors would be provided a digital signature key to sign their transactions. And we have indications that this would be expanded to a workforce health ID. Similarly, a device health ID could be issued, and so there can be a whole set of registries that are developed based on all these identities. Now, NDHM doesn't have a mechanism of blockchain-based identities right now, but if we take the approach of start small and grow big, there is a possibility that these IDs could be made as blockchain IDs. And then what that means is that any transaction that I'm doing on the network, I am responsible for it. And if I have signed the transaction and I've shared, let's assume that I have shared a health record with a doctor, only that doctor can see my health record. So that's the beauty of it. But there are steps that we have to take through, and India is a large country. But all the indications are that it's a very encouraging step, right? So that's at the identity level. And if we look at transactional processing, right? So in transactional processing, we could have health information sharing. Like, let's say that I want to purchase a health plan or insurance policy. That's what it's called in India, right? Now, I need not share my entire health information to the insurance company, whereas they could check my health record. Am I a smoker? Am I a drinker? Do I have any past medical conditions? Are there any allergies? Is there any family history? Without having to actually look at my health record, or like or my privacy being compromised, which is a huge thing when it comes to a health record, right? So the way they can do this is something called a zero knowledge processing, which is possible with the blockchain-based network. And the verifier can, with all certainty, be able to say that whatever I have verified is right, right? Similarly, we can have Ayushman Bharat has enabled insurance for 50 crore Indians. No other policy in India has covered so many, sorry, in the world has covered as many people on the planet Earth. Right? So now we want to do claims processing. So in the Western world, we have a lot of automated claims processing, but we can have in India we don't have that much coverage in terms of claims processing. By using blockchain, we could have automated claims processing and eliminate all sorts of fraud-based abuse scenarios, which are a huge problem in the Western world, even though they have all the automated claims processing systems. This could also be extended into trades management. This could be extended into drug-to-drug interactions, where the doctor will be able to prescribe the medicine without looking at, or they may look at, or they may not look at, but without actually looking at the prescriptions on the patient's medications list. Whether would there be any reactions, which is called as D2D interactions. All of these wonderful solutions are possible because of blockchain. And if we take India, so we want to adopt FHIR, which is, so it's an acronym for Fast Health Interoperable Resources. It's the HL7 standard, and we want to maintain all of our health records in a FHIR format, Fast Health Interoperable Resources format, which brings that semantic interoperability, or like one standard across all systems. Now, if you look at analytics or machine learning or even artificial intelligence, the foundation layer for that is data, right? So, and blockchain is the mechanism to provide that data. So we seem to be getting all the pieces of the puzzle together at the same time. And if there was no pandemic, probably we could have moved even faster. So that's my take on how blockchain can help healthcare.
I think that's an excellent start. In fact, that's a very good overview of where exactly we can have. So now I come to Vikas. For your experience, I think you have had a very extensive experience with the education sector. So maybe you can describe some of your success stories there and how you can use those values for healthcare. Over to you, Vikas.
Sure, so thank you. And I'll share my screen. So yeah, I just mentioned, first of all, amazing introduction from the perspective of introducing blockchain to the audience and its core usage, that where it can actually provide that that trust layer. Like when you mentioned that you can always delegate the trust to the network, that's just an amazing way to put how blockchain actually is becoming so essential in our daily lives, because trust is where like we put a lot of our future bets as well. So yeah, I will just take care of the things that I want to reuse my all of the energy that I have always invested into the blockchain domain, and we have used that energy in education sector a lot, and I have also invested some of my time into healthcare sector. So I'm going to talk about the amalgamation of the two. So it will be very high level. So a little bit about me already has been discussed in my intro. So I just want to highlight one point that we have a patent pending product in all these securing the digital documents using blockchain. So that just put us into a very unique combination that we just understand this area really well and help us to establish our thought leadership in this space. So I'll first talk about the top 3 lessons that we learned from securing the documents using blockchain. So if we essentially help understand the audience here is this, that any document that essentially that is healthcare document, let's say either it is with the help of Digidoc ID, let's say a doctor is getting their own identity, essentially they will be eventually signing the documents, and that signed document or signed data will always live on blockchain. So essentially, we are anchoring that information in the blockchain, and once that anchoring is done, we need to ensure that it is it cannot be it cannot be tampered with. And since it is being done with the help of the technology which we use even today in the banks, uh, just let me break down the security aspect of blockchain, like for the common understanding is this. uh, I hope everybody must be using banks, and essentially from some time bank always pay attention into when you use a net banking, they will always signify that, hey guys, kindly ensure that you are having this green padlock sign in your browser, which essentially is nothing but a secure layer, secure SSL layer. So generally, I just want to highlight that the technology that is being used in your browser to ensure that your financial transactions are safe with banks, the same technology is the foundation of blockchain. So there is nothing different from the perspective of blockchain, that blockchain has actually landed on my head just from anywhere out in the open. It's the very same technology, age-old technology, but packaged in a very different way. So blockchain helps us to establish the information is kept in untamperable way, and it is also removing the future inconvenience that we might have. Let's say when two people claims that, hey, the information that is living there might be of one of them, but they both are claiming that, hey, that information is belong to us. How do you remove those situations? So blockchain essentially just remove that sort of a problem uh, from the ground up itself. It doesn't let you go in that direction itself. So it just ensure that there will always be a single digital copy of any information that is out there. Of course, you can always do the same document again onto the blockchain, but in the stream of blockchain, it will never be the same information. It will be a different information. Hence, different footprint, different fingerprint of the document will live on blockchain. So never a single digital document or digital copy or digital data will have the same fingerprint on blockchain. Now, the last important point that I want to mention here is that, like, you can always be very sure about that the verification of all the information will always be super fast, and that always help us to reduce time. And when we are reducing time, essentially we are reducing the overall cost of the people involved into completing that transaction. So consider a case where, let's say a digidoc ID is given to the people, given to the doctors, and then a doctor says that he is a doctor with the so and so digidoc ID. But how do we verify? Can we verify it in a jiffy? That is the main offering of blockchain, that blockchain's data, since being it is open, anyone can verify. Anyone can immediately see that, okay, if that guy is claiming that this guy is so and so, we can ask them to verify that thing. So that is the some sort of a the way Venu, I'll keep quoting Venu's comment there, like, we have put the trust in the network now. Like, the network is going to handle these kind of verification layer for any sort of identity that is offered to the people. So verification of not just the identity, also verification of all the previous data also. Now, what that data is in healthcare related data will always be your let's say previous health record that has gone onto the blockchain, and that will always help you to establish the chronology of some events happened within your life from the perspective of healthcare. And let's say if next time I'm going in front of, let's say, Dr. Suptin, so Dr. Suptin can actually ask me, hey Vikas, can you share your last 6 months of digital data, or sorry, health record with me? And he can go through that, and he can diagnose something if he has to. So verification, a repudiation, these are just the out of the box offerings of blockchain. That's why not just healthcare, there are other industries also are like hell-bent onto using this technology as their core sacrosanct layer, from where whatever the information they will pull, it will be just trustworthy. Now, these are my lessons that I'm like that I can say that it is crossover from education to healthcare, that since Venu also touched upon an Ayushman Bharat, and we also have some interesting discussion that that we had with the people like who were directly responsible for the Ayushman Bharat, that we brought this in front of them that, hey, team, you will face a lot of problems going forward into the processing of claims, and that is first. And the second one, that you will face a lot of problem in segregating the fake claims from the genuine claims. And at that time, Ayushman Bharat wasn't even launched. We were telling them in advance that these are the areas which you will face if in coming time, if you will use blockchain. You might, I mean, I'm not saying like you will just eradicate all of the problem, but at least you will degrade, you will disincentivize a lot of wrong activity on the platform. Fast forward 6 months after the Ayushman Bharat was launched, or fast forward around 6 to 9 months, I saw it in the news that they have hired 6 different agencies to tackle the fake claims that are coming to Ayushman Bharat portal. Because it was super easy for any hospitals to start charging a lot of money on the on the basis of the people who were never been there. How do you verify? So whenever there are any incentivization mechanism actually is being provided to the common people, we also have to have a very solid monitoring mechanism, or at least a mechanism by which we can ensure that there will be lesser and lesser and lesser wrong actors who will participate in the platform. So this use case I really want to highlight, this case study I really want to highlight from the perspective of this, that we as a technology enthusiast, we and Dr. Suptan and I was there at that time, so we presented them this case that you are going to face these kind of problems. But eventually they didn't listen, and then they called again, like you, and they went into the same problem that we helped them foresee. So that is what my journey with the education and healthcare sector it is. So what we can use from the education sector is the anchoring of the important information in a very secure way. There are different concepts that I just will take the names. There is zero knowledge proof, by which the information will never be revealed to the communication channel, but eventually two parties can very well with confidence they can say that yes, information was correct or information was not correct, and the channel will never know what information which traveled. So there is no problem of man in the middle attack as well. There are multiple such cut-through technology that now exist on top of blockchain, on the top of layer one blockchain itself, that we can just be really sure about that this is last 10 years of blockchain has absolutely built the foundation of the amazing solution that are yet to come, and the technologies are in place, and this is what make me excited every day. So thank you, thank you everyone.
Blockchain is definitely being used in healthcare by various governments, even at a smaller levels, at state level, and internationally also. Different countries, including Estonia, which is supposed to be the leader in electronic health records, digital health system, so to say. So, but still, I mean, as we all of us would be saying that opportunities are galore, but really we are not yet into it implementing properly. But maybe we can look at the future, look at the crystal ball, and see what are the immense possibilities. So over to Arna for the crystal glass gazing.
That's a great opening by two panelists, and I'm more of a blockchain evangelist. I would say I'm not a tech guy, but I'm a founder CEO of a home care company called Patient Planet, and we are waiting for a big solution that incorporates this telemedicine as well as blockchain together. So I believe blockchain can transform healthcare and make it more patient-centric. It has the potential to digitize the entire patient life cycle by creating immutable records across systems and letting these bona fide stakeholders use those records digitally. But I also see many horizontal innovations and transformations happening in the healthcare space, especially about AI, blockchain, IoT, and machine learning. Now, along this transformation journey, blockchain also has the potential to automate and improve trust in healthcare delivery. And I hope our discussion will help us get a better understanding of it today. Now, there are several problems in healthcare that stem from the complex network of intermediaries and the lack of traceability of transactions. So, to mention a few, healthcare data is fragmented across several silos, negatively affecting the research and services. Now, half of the clinical trials might be knowing are never reported, and the cost of drug discovery is ever increasing. And there are substandard and fake medicines that are still a huge problem. And I'm part of Pharma Trust company in UK that deals with this pharma supply chain solutions. Now, blockchain has the potential to solve these problems as it provides trust without any intermediaries. It has traceability as a default feature and promises new business models by enabling novel incentive structures. Now, due to its potential, blockchain has gathered significant interest in the healthcare industry. I believe the stakeholders of Indian healthcare ecosystem are currently at various stages of planning, designing, implementing, and adopting a blockchain-based solution to mitigate some of the key challenges. And there is a participation from both private and public healthcare systems to adopt blockchain-based solutions for enabling their medical record systems to map health informations, such as health summary, vitals, prescriptions, and reports, to the respective citizen ID, like we have for in Atmanirbhar thing, the digital health ID that we have talked about. And similarly, efforts have been made, to form a consortium to explore the various blockchain use cases across the insurance industry. And I believe some of the advantages of blockchain in this reimagined scenario, I would say it's a patient-centric blockchain-based approach to improving clinical care will benefit both the providers and the patient, and the healthcare ecosystem will stand to gain. And at the end, the patient's trust is maintained. So the benefits of such a blockchain-based ecosystem can be categorized in two types, those for the provider and those for the patient. So I'll briefly touch upon a scenario for a home care vertical since I run a home care company. We all know monitoring of patient is so important for home care patients. And so, in this case, both the provider and the patient gets benefited. Now, for the provider, it allows remote monitoring of patients by providing a formalized and common blockchain platform to integrate the data being captured and monitored by patients' personal health devices like the fitness apps and home medical devices. For the patient, scope for an enhanced technology integrated patient experience through integration with fitness trackers and home devices such as smart speakers for reminders and medical devices for benefit monitoring allows secure and remote connection with the provider. And I also see a huge potential in the healthcare data management system. The healthcare data, which includes storage, access control, and sharing of the data, we all know is an important aspect of the healthcare industry. So proper management of healthcare data, it improves healthcare outcomes by allowing holistic views of patients, personalized treatments, and efficient communication. Now, it is also critical for operating healthcare industry to be cost effective and efficient. Now, healthcare data is a challenging task to manage the healthcare data due to its sensitive nature and subsequent trust issues. As Venu said, there are going to be trust issues. That's one of the reasons we are having this NDHM and all. And it's one of the main reasons why the healthcare system is at the moment disconnected, because healthcare data and services exist in disparate silos. healthcare professionals generally do not have access to the complete data of patients. That's one of the biggest problems we have. Thereby hampering the subsequent diagnosis and treatment steps. Now, if researchers struggle to find the desired data for their studies, thereby slowing down the healthcare research, blockchain, we believe, may enable the efficient sharing of healthcare data while ensuring the data integrity and protecting patient privacy, and it's going to be very secure, efficient, and cost effective. Moreover, the adoption of blockchain, I believe, can push forward the movement of patient-centric healthcare model, where patients control their healthcare data. The major hurdles behind data sharing in both patient-centric and traditional models are, lack of trust and lack of incentives to share. Now, interestingly, you can say blockchain technology can solve both problems by acting as a trust layer and introducing the incentive mechanisms, such as rewarding crypto tokens for sharing data. Moreover, I believe blockchain can be the bridge for the integration of medical device data and healthcare Internet of Things. The healthcare and lifestyle data collected by wearable devices, can be critical for correct diagnosis, but are underutilized since there's a lack of proper way for a physician to access the patient-generated data. Now, with blockchain-enabled trust and incentive structure, I believe there is a promise for a global health information exchange and a marketplace on top of it. But the lack of common healthcare data standards can be one of the major obstacles to overcome before the development of a interoperable HIE connecting multiple disparate data silos. However, I believe there is a possibility that the incentives introduced by blockchain-based data exchange may fuel the creation and the development of the open data standards. And blockchain-based HIE will be an interesting use case, that requires the balance among privacy, transparency, and efficiency. Moreover, country-specific regulations will be another obstacle for a HIE connecting multiple regulatory regions. Now, since patients have full ownership of the healthcare data in many countries, blockchain-enabled patient-centric healthcare data model can be one fitting way to bypass these regulatory challenges. Another use case for blockchain, I would say, is in the area of telemedicine. Telemedicine is another area in healthcare that can benefit from blockchain technology. And by introducing a trust layer between the patients and healthcare professionals. And now, blockchain-based telemedicine platform, as Vikas said, can validate professional identity and data integrity. And it also ensures transparency and traceability, and incentivize the players to act fairly by providing incentive metrics such as reputation scores and crypto tokens. Now, successful development of such platforms may create a global healthcare marketplace in the future. And in the future, effectively balancing the global supply and demand of healthcare resources and needs. Now, within telemedicine, it is likely that the remote diagnostic services will be at the forefront of blockchain adoption. Now, it can be expected, that diagnostic services solely based on quantitative and qualitative interpretation of medical data in the absence of a patient will be the first to adopt blockchain technology successfully. Now, many startups in this area, I believe, corroborate this anticipation, and many of these startups are targeting the services where the diagnosis of a medical condition is based on interpretation of patient data. Also, if I can talk briefly about some of the key considerations of blockchain adoption. or scenarios for blockchain adoption. We might come to this later. That's all I want to add now.
I think you can carry on with that. I think that's very important. So what are the key constraints? Go ahead. Then we'll come back to the other speakers here.
Right. So I can talk about 3 scenarios where blockchain adoption could be done. So scenario A would be where multiple parties, have to share data. Now, multiple parties need a common view of the information being shared. In case of like hospital admission, doctors from various specialties view and work on the patient's clinical data for deciding the treatment protocol. That's one of the scenarios. Now, let me talk about the second scenario. When scenario B, I would say when multiple parties need to update data. The actions, undertaken by multiple parties need to be recorded and updated. Discharge summary of an admitted patient. For surgery is updated by various doctors, like admitting doctor, surgeon, and anesthetist. Now, this is the second scenario. Third scenario I can think of when the data verification is required. Now, an element of trust needs to be enabled in all the parties, updating and handling data for accuracy and validity in case of emergency admissions. The trials done by a nurse is further verified and validated by the treating doctor. These are some of the scenarios that I can think of. Blockchain can be a big enabler and facilitator. Thanks.
Arnav has touched upon very pertinent points. I'll pick up probably few of them, not all, and I'll come back to Venu. I think consent management framework, that's something he has raised, and that's a very important area where this breaking the glass concept, I think we've had a lot of discussion on that. So Venu, how do you really go ahead with this consent management framework?
Sure, Dr. Supten. Consent as it is, medical data is a lot complex than any other domain. So without getting into too much specifics of what aspects of the records are we enabling as of now, right? We could enable a blockchain-based identity providing a cryptographic key pair, public key, private key is what we say. Like all you get is a digital key for yourself. And then whenever you are sharing that data with a participant, we can do a lookup of the participant. We have all the tools available. Select the participant at whom we want to share the data with, sign it with our key, attach their public key. Public keys are public, right? And we can send it to the recipient. The recipient may be a doctor, the recipient may be a nurse, the recipient may be a related person or a family member, is what is called, or anybody in the healthcare ecosystem. And it can go even in a insecure web, I mean in a HTTP world, or it may travel on a HTTPS world. There is only the recipient and only the recipient can view the record by decrypting it using their private key. The simplistic example I would give to this is, you know the answer as 6, right? But you know 2 multiplied by 3 is 6, and 2 and 3 is with me, you will send me with 6. So until I arrive at the same multiplication, I won't be able to view the data myself. A lot of complicated process happens in computer parlance where it is called encoding and decoding. So let's say 6 is my public key, so I would encode it with 6, and I have to decode it with 2 and 3. That's what I meant. So this would actually enable seamless, and that's why we call that it's privacy preserving. No one else other than the recipient can view this data. So consent management where privacy is a big issue, like, and it can also be done that, okay, let's assume that I have transferred this data to the recipient. Does it mean that the recipient can view the data forever? It is not like that. So that's where the concept of smart contracts come in, where we say that I am sharing this data for a certain period of time, and that record is stored on the blockchain. So when the recipient tries to access the record, they first negotiate with their credentials or identity with chain, and the chain internally goes and validates the validity of the contract. And if the contract is valid, then allows them the access to the record. So this is a multi-layer approach. It's not just like I've given you the record once and then you have the access for it forever. It's not like that. I can even set multiple smart contracts, like how many number of attempts, right? It's all part of possible. But that's how consent management could be achieved using blockchain.
Great, Venu. So I come back to Vikas. Vikas, you would like to address any of the issues or the scenarios which Arna raised?
I think Arnab raised pretty good points around the interoperability, because eventually blockchain's USP is like when multiple actors, they came onto the platform and they can actually source the data in the same way, they can actually read it and start using it immediately. So having a common platform where the information can be used, interoperability can be achieved around the data. That's a very, very good point. And now I want to come back to the pointers, like what just when you touched upon is this, like how can we encode the data so that only the recipient of this intended recipient of this data can only be the one who can see the information encoded in this. So I think this is again a very good one. On top of this, what I think when you said, I think I can say that this is where these use cases becomes the prime example of zero knowledge proof, like where even it doesn't matter like where it is traveling. Like I like the way when Vinu said that whether it is out in the open, just an HTTP world or an HTTPS, but the data will never ever be revealed. Like what data, even what data is traveled, that is also not revealed. Very cannot be even seen. And again, if I would like to come to the points what Arnab mentioned, is that how can we ensure like the identity again becomes starts playing the key role of the patients and the everyone, so that the same identity becomes the foundation of sharing or putting any information in the blockchain against that identity and pulling around that. So good pointers, all I can say. And important takeaway for me is essentially what the NDHM things. I think these are really I think I should definitely have a look around all these things, because these are, and for the audience of this session would be, these are the good takeaway points.
Arna, back to you. So based on the responses from Venu and Vikas, what's your take? Anything you want to add or further enlighten?
I think, as Venu said, smart contracts are going to be a big thing. I mean, it's really going to be a big thing in the insurance industry. When things automatically happens, when there are several use cases in the healthcare insurance industries. So smart contract and things like that blockchain enables or helps us, facilitates with, will be a great help in this healthcare ecosystem. And yeah, that's one of the things. And the health ID that we are coming up with shortly, that will be really helpful.
Either Venu or Vikas, you want to add something on this, or otherwise we'll come to the final round of concluding remarks. So before that, anyone wants to volunteer? Because I think we have discussed on a lot of opportunities, a lot of possibilities. Of course, there are problems in both the policy domain as well as the implementation part. But any thoughts, either of you? Yeah, Venu first.
Yeah, I would like to add one remark. So both Arnab and Vikas had mentioned that if we have a standard, then it makes more easy to share the information, right? And we are there. So NDHM accepts fast health interoperable resources, or FHIR, as the standard to exchange the healthcare information. Good or bad, the developed world has a lot of other standards. We haven't had anything as of now. I mean, we had the EHR standards, not to be confused with that, but we did not have an exchange mechanism as such. So now it is for us to take the FHIR standard and build on top of that and take advantage of what blockchain offers.
Yeah, if I come back to the policy document, the National Digital Health Blueprint does talk of the EHS standard, second edition, December 2016 of the Ministry of Health and Family Welfare. Additionally, this FHIR Release 4, the FHIR Release 4 and the EHS standards 2016 is what the National Digital Health Blueprint recommends. Although the National Digital Health Mission is not going straight away with it, because I think they would start small and, as you said, fail fast. Scale big, fail fast, but it's a lot of players are involved, a lot of stakeholders are trying in their own ways. So on paper, at least on the policy we have, because you brought in FHIR again, FHIR is definitely a very promising thing, and most of the countries are adopting it very quickly, even before it becomes a formal standard, because we have the release 4, it's still a draft standard. It's not really a formally published standard like V2 or V3, the various editions. But another paradigm which has come is the smart on FHIR. So where you are using basically mobile based. And if you look at the PCH standards, the Personal Connected Health Alliance, so between all the layers, the various home care, I mean, IoTs, wearables, everything, to the HIS, there's a lot of interfaces in between. And you need a lot of diverse standards, and obviously you have to harmonize the standards. Unless the standards are harmonized, we can't go anywhere. So, Venu, would you like to talk a bit on the smart on FHIR? Because I think that would be very relevant, even to what Arnab said about when we talk about this telehome care, or remote patient monitoring, diagnostics, and so on. Over to you, Venu.
Sure, yeah, thank you, sir. So, smart on FHIR is a sharing mechanism. It's not really FHIR, but it's been put up by SMART, which is an alliance which started off this journey. And they came up with this strategy that, so FHIR in its pure existence is an API, which is an application programming interface. So what FHIR recommended was to, what Smart on FHIR recommended was to set up access controls, role-based access controls, if I can say, at an API level. So what it means is patient is a resource, observation is a resource, condition is a resource, care plan is a resource, right? So I would be setting even medication statement is a resource. So I would be setting permissions on those APIs itself. And because we have so many roles in healthcare, it's a two-layered approach. So let's say I have granted access to the recipient. It's not for me as a commoner or as a normal citizen to know what is the role of the recipient, right? So I have granted the access, assuming they are acting in good faith. But Smart on FHIR also has another check where it says that are these recipients allowed to view this record? So the scope, which is called custom scope, is actually an OAuth 2 paradigm. So in OAuth 2.0, we have these custom scopes. So only if the recipient is allowed that custom scope is where they would be viewing this record. Otherwise, they won't be. There is another thing called launch context. So launch is, because this is again complex healthcare world, and there could be emergency situations, right? And I may not have access to the patient, but I still want to be able to view them, right? The patient may not have granted consent for me, but I still want to be able to view their record because I don't want to miss that 1 hour golden hour period, right? Then how would I do that? So that's where I can actually break the glass and do a launch contact that, look, I am wanting to launch this patient, and there can be a mechanism put in place that this is the emergency encounter. Now grant me access to the patient record, right? And there can be audit or anything, but the launch context itself can set that I am allowed to only view the patient and not anyone else. So there is no way that I could play with the system. So context-based interfaces should be developed using Smart on FHIR.
No, I think we have really covered a useful
Amazing
topic in a very meaningful way, and we have really may not have answered a lot of concerns, but raised many issues which are very pertinent and everyone needs to look into going forward. So Venu, your take-home messages.
Yeah, so we are at a great step in our existence. Like I think about that every day I wake up. So we should not be frightened or inhibited by the challenges that stay in front of us. We as a country are a large, diverse population with a lot of issues to handle, and we're in the middle of the pandemic. It has not subsided any. So we should not lose hope, but collaborate more. So that one thing that blockchain says is collaborate and compete. So we should collaborate and not stop here. Like NHM says, start small but grow big. So we should bring up these points and look for more meaningful solutions and enable them. My take.
Yeah, I think that's well put, Venu. So over to you, Vikas. What are your take-home messages and concluding remarks?
First of all, amazing information and insight that we have gathered. I personally, individually, is very like feeling amazing about the information that I collected into the healthcare sector. And the as collaboration word has already came out, so from Venu again. So generally, this is the point that collaboration over competition is what blockchain promises. So as long as the stakeholders in this ecosystem, and it just not just the individual doctors, clinics, it's just everyone, every ecosystem, like can like amazing points raised by Arna, that how can we even integrate the digital tracker, fitness tracker into the ecosystem? How can we include them as well? These are really, really important discussions. As long as we will not kindle the fire, so this kindle this discussion, something and nothing is going to come out of it. So I think again, congratulations first of all to bring up these pointers on the ground, and I think we'll definitely move ahead with some solid steps after this. Thank you.
Thank you, Vikas. Now over to Arnav for your take-home messages and concluding remarks.
So I would like to conclude by saying, healthcare generates more data than any other industry globally. Now, however, given concerns about both privacy and tampering of data, I believe there's a suboptimal use of this data. Now, blockchain addresses both these concerns and could revolutionize, the way we use data to enhance the clinical outcomes and reduce costs also. So I believe, blockchain is the future of healthcare along with AI and IoT. You will see a lot of interplay among all these techs. So how it needs an ecosystem, to thrive in, which should be based on health information exchange, definitely. From what I gathered from other panel discussions, it sounds like it's in the early majority of the adoption curve, and only until common platforms prevail and more testing is completed across various use cases will it move into late majority. And I believe now is the time to experiment with different use cases and to keep a finger on the pulse of what other technologies and strategists and regulators and thought leaders are doing. I think this way we will be able to mitigate the risk of early adoption while staying on top of the latest possibilities. And I look forward to continuing the discussion and participating in what's next. Also, believe before rushing to adopt blockchain solutions, organizations should, carefully consider whether the technology is appropriate and has advantages over the existing alternatives. And I believe also we must ensure that the tech aligns with the KPIs of a typical healthcare ecosystem. That's very important. And lastly, I believe all these techs would result in a better clinical outcome and empathy for the patient. As my Otherwise, I would say it's all noise and not a real value proposition.
I think well
Over
said,
to you.
Arnav. And I think early movers will be the early adopters as well. And of course, a lot of stakeholder buy-in is yet to be done. And we need to show the value. I think that it works and works well and solves so many problems we need to show. The community is growing. That's a good sign. And I think all of us are happy to be a part of it. And I would personally thank all of you, all the panelists, for enlightening me today as well as the audience. It has been a very fruitful discussion, and I'm sure we'll be going ahead. So next time when we meet, we'll definitely be able to show off some real success stories, which is useful to, as you rightly said, the human being, the people. the patient at the center or the human being. Need not be just a patient. Even health is very important. Health is more important than healthcare. So it's the people's health, the community health, everything, the outcome should be better. And definitely blockchain can play a very big role in ensuring that. So thanks to you once again, and namaskar to all.
For more updates from CXO TV, please like and subscribe to our channel.